everyone has an idea to say, my leg is like this, but I've noticed it's swelling up a little bit. That may happen with the breast as well, okay? So you may notice some changes, and some of those changes, to be precise, may include skin changes. There's what we call peel d'orange, which is peel of an orange. You know how an orange looks? It's got little dimples in it, like so many of them, small pores, right? You may notice something like that. It's as if an insect has bitten you. You may notice something like that. That's one. Two is you may notice some discharge, all right, from the nipple. And this discharge may be, usually is blood. Sometimes maybe just serous, mean that it's watery, okay? What else you may notice is dimpling. Dimpling means that on the breast, it is, let's talk about my head, for example, right? You can see that my head is smooth all around, all the way up to this side. But what you're going to notice is there's going to be a little dimple that is going to form there. And that may happen on the breast as well. That's what we call dimpling. You may also notice that you may have a lump within the breast. Now, lumps are quite common. I should mention that firsthand. Lumps are quite common. They are not an immediate sign for you to suspect cancer. All right? But, of course, if you do have them, and you do notice that they're getting bigger and bigger, perhaps even painful with time, then it is a cause for concern to visit the hospital. All right? Now, certain myths have us thinking that breast cancer is for only people who are above age 40. All right? Most of us have probably thought about that once or twice. All right? But that's not true. Especially in this day and age where we are seeing a lot of changes in lifestyle. We are seeing even certain other conditions such as hypertension, which we commonly call as BP. We are seeing it in a younger generation. Just 1 month ago, I was seeing someone in the emergency room who was 25 years old and had a stroke, right? We know stroke, right? Yes. And most of the times we see stroke in people who are 50 and over, okay? So we're seeing a lot of changes in lifestyle based on the food we eat, the environment we're exposed to, technology, maybe, maybe not. They talk about Bluetooth. I can't comment on that. Yeah. But those are some of the things that you may notice, okay? So the breast lumps may be present, and most of the people who diagnose breast cancer may first notice a lump. Now, how do you distinguish a normal breast lump from a lump that should have you worried? A lump that is normal will persist in terms of size, in that you will not notice any remarkable increase in size. All right? You may notice during the period, the monthly cycles, right? You may notice some slight changes. But as soon as your periods are done, you find that the size comes back to what it was before. And if that is what has been happening to you, then perhaps there's no real need for you to start having a heart attack right now, okay? But if the opposite or the reversal is true, where as the size goes up and up, it doesn't ever come down, then maybe you need to come and have a chat with me so that I can advise you on what we can do next. All right? So that's a few ways that you can try and spot breast cancer. But then, let me run you through how you notice these changes, right? It's not just going to happen, you're dressed up and you're walking in town, it's like, oh, I've got a lump in my breast. No, that's not going to happen like that. You have to be in a place where you're comfortably examining yourself. This is your bedroom, your bathroom, preferably in front of a mirror. I hope we have mirrors, eh? Just to make sure that you've brushed your hair and so on. But as we are doing that, as we take our baths, as we dress up, and so on, it's a good time to examine the breast. So I'll give you a scenario of me coming out of the shower, or at a point when I want to examine my breast. I'll stand in front of the mirror, and I'll say, mirror, mirror on the wall, who's the fairest of them all? And the mirror will say to me, it is you, right? All right, so you will stand in front of the mirror, and you will make a comparison of the breast. So you look at the chest generally, and see if there's anything unusual. It's not going to take 10 minutes of your time. Practically just 10, 15 seconds to notice some of those changes. Once you have noticed anything or you have crossed that path, all right, this is as good as it was yesterday, you raise your arms, something like this, or over your head, okay? Once you have done that, again, you ask, mirror, mirror on the wall, okay? And then you notice for any changes in the breast. You notice, and that's when you may see dimpling. So you will think about dimpling the way people who have dimples appear, right? When they're just sitting, looking at you so seriously, you probably not see a dimple. But when they're happy and they're smiling, then you're going to see a dimple, right? That's kind of what you're trying to achieve there. So you're looking for dimpling while doing that. So once you've put your hands down after that, you do not notice anything unusual, you can take your hand, these three, all right? These three fingers are what you're going to use. So you take them around in a circular motion around the breast, making sure that you reach every part of the breast, okay? These three. So you check from the breast, from the point of the breast, and you go all the way into the armpit. Now, why must you go into the armpit? It's because the breast tissue extends into the armpit, okay? So that's just how God made us. It extends from all this way, coming down, up to the point where the breast is remarkably observed. All right. As you go on examining, you can do that while you're standing, and you can also do it while you're lying down. You probably get more out if you're doing the examination while you're lying down, because then your examination will not be affected by gravity. Okay? So then you have a more thorough examination. It's better to use, if you're taking a bath, you can use soap and water so that you have proper lubrication as you're going around in that circular motion. If you've got hands like mine, you have trouble getting across the skin because my hands are rough. Okay? Another good time is when you're applying your lotion, because lotion also may act as a lubrication, right? So you can go ahead and do that. Some other things that you may notice other than the obvious changes in the breast are general weakness, fatigue, loss of appetite, things of that sort. Okay? So those are what we call non-specific symptoms. Meaning that when they happen, you won't know that, oh, I'm having this because it's breast cancer or it's this. It's non-specific. You just start feeling off. That's what many people tell you in the hospital. I just feel different. I feel off. I've got no appetite. I don't want to drink water. I just, even when I drink it, maybe I vomit and things like that. Okay? Now, given that we do know how to do this, how often and when should we do a breast examination? For gentlemen, probably any time. Okay? How frequently? I encourage you to do it at least once every month. All right? For ladies, it's a little bit more specific, especially those who attend. Okay? The best time is to do it 3 to 5 days after the menses. All right? The reason for that is during the menses, you may have a lot of cyclical changes happening. The breast lumps that I talked about earlier, they may increase in size during the menses. Now, that is going to throw you off. Okay? That is going to throw you off. I'm not saying don't do the examination during that time. You can, to compare. But if you want something that you can take with when going to the hospital, best to do it 3 to 5 days after the menses. Okay? So again, in terms of frequency, attempt to do it at least once every month. All right? If you notice anything unusual, of course, the best would be to visit a hospital. And this is something that a lot of us are unable to do most of the times. And I'm saying this out of experience of interacting with many patients. A lot of us will probably only ever go to the hospital when we have pain. Is that true for everyone? Only ever when we have pain. When you have no pain, you would have a swelling this big. And we've seen that. This big, and they'll never come to the hospital. Especially if you're a man, you're not concerned about how you look. You're already married. You won't mind. Right? As long as my wife accepts me, it's okay. She said her vows, it's okay. Right? But then if you're concerned about how you look, then maybe that will prompt you to go to the hospital. If there's no pain, even worse, you will never touch the hospital. You'll probably also be discouraged about the people who are in the hospitals. But when I go to the hospital, they'll tell me, you are coming to the hospital, it's not serious. Why are you coming to the hospital? That has happened to some of us before, right? Yes. And I want to tell you now that even though I'm a healthcare worker and I know several other healthcare workers, not everyone is as knowledgeable about breast cancer. Not everyone is going to point it out. No one is going to know the real need to do a breast examination. So you must insist. So that's an encouragement from me to you. Don't go to the hospital and say, they told me that it's not anything serious, so I need to go home. Be checked, be tested. There are certain tests that we're going to do on you. And some of these tests may include ultrasound, a mammogram, so things in that line. So have people do something like that on you. An ultrasound, perhaps. All right? So that ultimately, once you are done with that hospital visit, you can go home comfortably saying, I have no breast cancer. Okay? Or at least it's not anything I should be worried about. All right? So, what is your role? You as a student, you as a member of this community, you who has a boyfriend, a girlfriend, who is a daughter or a son or a father, what is your role? Your role today, and what I'm encouraging you to do, is to spread the word. All right? It's perhaps maybe the only reason you're sitting here for, so that you can go and encourage the next person. All right? I've not come here because I'm thinking that any one of us is going to get cancer. No. But I think there's someone out there who may not know about breast cancer, who may never have known about it. But this is October, the Breast Cancer Awareness Month, and I think it is each one of our responsibilities to raise awareness as much as possible. Encourage your sisters, your brothers, to do a self-examination. These days, with technology and so on, what I'm talking to you about is possibly already on the internet. Someone has already said this, maybe thousands of times before me. All right? So you can check on the internet for how to do a self-breast examination. You can download some literature and share, even through a link and so on. Whatever way that you feel that you can. How else can you raise awareness? How else can you help the community? You can visit the Cancer Disease Hospital, see the women there, and offer them some encouragement. Auntie Kathy does that. She encourages a lot of the women who are struggling with breast cancer, right? So once in a while, you could take time off your busy schedule. I know students are very busy, always studying, trying to get this and that done. But once in a while, you go and sit down with someone and just spend 20 minutes talking to them. Encourage them, right? What else can you do? You can create activist groups. You can take walks. Student bodies are perhaps the most influential bodies in the world. Why do I say so? Because student bodies, everyone is going to school, all right? And when you stand here and say, today we shall march on this road, people will say, oh, who are those young people? What are they standing for? What are they speaking out? And what are they preaching? Oh, I think I need to take keen interest. If the young people are saying this, what about me who's much older? So you can do that. Go the extra mile, whatever you can think about. All right? So allow me to end my presentation here. Thank you so much.